Wait, you should be going. Take that out and then mic in. Cool. So microphone. You just need to talk around here. The microphone. I think there's no space.
Thank you. So, moving on to namaste for our safety. Here are home center. Navin from Melbourne, Israel, and working at the Road Institute. And well, just a bit about myself. I guess background. I work in PG. I went to school on the road in the morning while and very road in Amity. I did my high school up there in Melbourne. After that, I moved over to Queensland and did my study for 18 years of it, 16 years at PG, 18 years. And just coming up to a year in Australia. I am a medical laboratory scientist. I did a bachelor's in medical laboratory sciences, did a bit of public health study as well along the way. I have worked in the humanitarian aid space in the Pacific region through NFA funding, through a not-for-profit organization, Pacific Technology Training Center out of Wellington. And this is where I work mostly very closely with our colleagues like Narish and Cole and others in the Pacific region over the years. And I hope to carry on doing that on my new role still find my feet there in terms of what that means in terms of capacity building, but my role is capacity and training building manager at the Dorothy Institute, and my email is there as well. So please feel free to reach out after the presentation, etc. If you have any questions or would like to have ongoing conversations about the Dorothy services and how it integrates with digital platforms in the lab setting in the Pacific. So a brief outline about my talk. So just I'm going to cover a landscape of the laboratory information system of the Pacific region. Hopefully it's accurate and good, so please feel free to correct me as well. It is a snapshot of the most updated information I have as of last week. And some of the standard requirements or regulations that we from the laboratory setting need to meet. So I'm in no way hiding this. So I'm just going to talk about the technical requirements if you like, and maybe not keep it too technical and keep the language understandable to everyone as well. And then the other digital platforms that we do use in the laboratory setting, there is sort of like important consideration when you're thinking of any information systems or digital systems you are wanting to implement in a lab setting. So the way I see it is what you call it, the labs made up of three key areas. This is the board there. We have pre-analytical, analytical, and post-analytical phases, or pre-examination, examination, and post-examination phases. All of which you see in a medical laboratory setting wherever you go in the world, whether it be a very remote district hospital setting that has lab in a small room, or might not even be a room, and maybe even to a sub-divisional or divisional laboratory setting. This is sort of like where this LIS sort of like we think about labs and services, like when we are always trying to fight for our identity in a hospital setting. Labs generally stuck away in a corner of an area. Generally, there's no signage covered where the lab is. You might know lab as a laboratory service. During COVID, lab was known as the place where you put the nasal swabs collected, not actually where the testing. So we're always trying to fight our identity within the services to ensure that we are recognized that we do an important critical part of and form an important part of our level sort of hospital setting. But it is one of a very complex ecosystem within a big ecosystem of hospital setting. We have multiple sections within the lab as well that also form the laboratory information systems as we need them to work for us. And as I mentioned, a little bit of visualization about our pre-examination phase. This is where our sample preparation happens, and this is where the label barcoding is generated, if you like, for the specimens. Our research forms are also received here from the clinicians and clinicians. etc. And accessioning, I guess, or receiving of accessioning is happening here during our pre-examination phase. Not very much testing, but it's more about getting out for actual testing of the samples. And we go into the examination phase where quality control testing is critical, but this is where analyzers are used. There's the methods are automated and semi-automated as well, and then manual methods that we still use in the region. So generally, off-the-shelf laboratory information systems not necessarily wait in our testing setting because there's a lot of manual testing that we do. There's very less integration of data from a testing platform to one test system. And then the post-examination, which is the key output, if you like, of the lab services, is the result of the put out to the physicians and clinicians, so they can use it then to manage a patient and improve health outcomes. And that has to be quite timely. So, ideally, physicians expect a result within an hour of sending a sample to the lab, but it is quite complex and you can't really always meet that turnaround time. You can for some analysis, I guess, like CSF microscopy, etc., but most others you can't because it requires complex testing. Hence why you need a good system to actually manage this. And it's important to see laboratory information system as another staff member really. That plays the role of a lot of staff members within the laboratory setting. So this is some other visualization of our pre-examination and then examination and post-examination phase. This is sort of like getting it a bit more complex. So once you start to deep dive into what the lab is, so obviously you get the tests are ordered from the physician and ordering would be fantastic if that was possible. Samples are collected, maybe not necessarily by the physician or the nurse. Maybe sample is collected at the outpatients unit in the laboratory section of the laboratory services. And then some of this stage, they often receive by the laboratory or the specimen reception of the laboratory services. Receive the samples, they are accepted, the specimens are then distributed with the various different sections, which I'll deep dive into a little bit later as well. Samples are prepared along the way, they might be loaded into the machine or manually processed, and then tests are performed either automated or manual. And then the QCs performed along the way. We have to ensure that our staff are trained and competencies are maintained to be able to do the complex testing of the lab services. And then obviously the results are viewed by the lab staff. They have to be validated. If it's an interim result, then that gets released then until a validated report can be released. And then it goes through, and then the results are set out to the physicians, etc. And as you can see, that can be quite complex system. And it's important for any implementer to understand what that lab means. And it does vary from site to site, location to location. So, sorry, I'm going to bring all of that up there. So, just mentioning that it is an ecosystem. It is a complex ecosystem as well in the analytical phase. So any system that you're thinking of implementing or planning to use has to be fit for purpose. It has to suit the user requirements of the lab itself. And these are all the sections that we have. So serology was often in most of Western countries without getting license and machines to use and perform testing, they're manual. So there's a rapid antigen test that you see, and we have used for SARS-CoV-2, but we use multiple rapid antigen test kits within the laboratory, so hepatitis, HIV, syphilis, etc. Then we've got biochemistry, which is mostly automated because we run our testing analyzers. Then it requires samples to be barcoded, that barcode could be read by the analyzer itself. There's some where you have to manually enter the patient details that don't have the capability of barcode reading. Microbiology is the other section which is semi-automated. I mean, the only automation in some of the countries is blood culture bottles that are read automatically, and you might read some reports automatically from it. Then you've got AST, Phoenix, analyzers, etc. that some of the sections use, and there's just like Samoa and PG, and hematology is semi-automated because you've got analyzers, and you've got manual microscopy reading as well for reporting of complex morphology, etc., including malaria, parasites, etc. But banking is complex because you have to issue products. You have to do testing, but you also have to issue products as well. So you have to process blood, you have to spin it down, you then have to order, issue blood tests, etc., and blood products like platelets and whatnot. Molecular infections is because it's mostly automated, but it's also semi-automated as well when it comes to open RT-PCR testing, like the compare which you have studies. And you've got histology and cytology. That's mostly manual because it's actually looking at biopsy slides and tissues that is collected for postpartum, or just biopsies taken around finding the aspirates, etc., that is collected in the wards, etc. And that is a complex procedural process. It requires very high level of expertise, and you often have like clinicians that specialize in pathology that performs the testing. Whereas from a lab perspective, as a medical laboratory scientist, who's preparing the slides for physician to read, that is the expert in analytical pathology. And all of this backbone is formed and controlled and managed by laboratory quality management systems, which should be a key consideration for any systems that you implement with the lab. And I'll go into a deep dive into that topic a little bit later as well. So this is the exciting one. I think this is like a live landscape, and I love doing this for the map from with WHO. But these are our labs around the region. I don't have the data on American sample, but they do have an alliance system. I just don't know what it is. And obviously our friend Polynesian and Nickelodeon, etc., they have a laboratory information system and they've had for years, number of years. I don't know what it is either. Those are actually regulated labs. They have an external accreditation they need. All the other sites here, so apart from Palau, they've got Senai this year. I think this is going to the best fantastic. Then we've got Federated States of Micronesia, Australia, that just had this HC lab installed. And they're using that, and that's the plans to roll it out on all the 4 states there, which is Australia, Quantai, and Nauru doesn't have anything, but I'm looking at Senai implementation of the this year. Absolutely fantastic. Philippines have none, but they're looking at Senai early next year. I think funding is being sorted on that front. Papua New Guinea, again, Papua New Guinea is a very complex country and it's got multiple layers. So it'll be yes, and I can this year, maybe that's what I think in our science understand. And then Solomon Islands, they don't have any alliance or laboratory information systems. Tuvalu and Tokelau are the same. 112 had chemistry and had chemistry for a number of years, but it's just not helping utilize. So they're using Excel for reporting. Chemistry, I think, was developed locally in PG has Talents, I think it was implemented in 2017 to 2018. And Tonga has an in-house system. I don't see Walter here, but they have developed something for Tonga at the back of their hospital information system, but it's not a true LIS. 2022-2023, they have the PC lab performance specs as well. And I think that's it. Obviously, some more looking at the Senate early next year, but sounds think or maybe later this year, which would be fantastic to be using Excel files and shared drives to manage the results, which has its risks on its own, but it's a different works right now. With Australia and New Zealand, we've got multiple systems. I've mentioned some of the ones that I've used personally, like Medicare, Seasonal Selfie, Starlims, Thermo Fisher Clinical, laboratory information management systems, and Ultra laboratory information management systems. And some of the feedback from the labs, some of this is coming from the feedback from the world. This is like fresh, or we received it last week. They're looking at like they're using paper-based system, and this applies to everyone as well across the board in the country. A lot of gaps and issues that we face when we use paper-based systems. In terms of reporting bad results, so you got missing results. You can't double check the results as well. You know, it's a very if you're reporting with paper, general accounts are not managed. You walk into a lab, pigeonhole is filled with results that has no one's collected, and it hasn't been distributed to all the lab settings. And in the world, so lab does all this work, spends all this money, but no one actually looks at the lab results. So those are the gaps that paper-based system unfortunately brings with it. And the world would love a laboratory information system. This is some of the feedback for so the second one there is like MedTech that you do, or MedTech 2, I think that's right. I don't recall what it is. For pilots, we're using it, Tomo was using it, I think, to some extent. And newer uses MedTech as well. It is not a laboratory information system, it's more of a patient management system or a hospital information system that collects and there's a lab module where you can go and put in some results and type it in. It doesn't have any interface at all. Now this feedback is huge and it's quite important. I think we just go through it very quickly. So if you have a system it's important that you test it, right, and you do user testing on it, because there are advantages, and this person has listed that there's less paperwork and writing. Results have been, they're able to easily access results. But these are the key issues that they're facing. So they're technical and software problems. That include just not the failure of the system to provide some of the required lab features. And there might be failure of clinicians to be able to request or order results. And many samples get rejected, and therefore software issues result in not being able to be pushed to the patient information system. Validated results fail to be marked as being validated. Patient details do not appear on the lab workers. Add-on results cannot be added on to the system, and if they are, then the sample numbers are duplicated, which makes it a bit more complicated to do that testing. Unable to view the reference ranges, and in some sections they still have manual entry into the system. So a user acceptable testing or UAT is very, very important before you go live with those systems. So I know all the issues. So you get better performance of use by people at the start as well. One of the key things as well before you start implementing a lab information system or any other system is to meet as a leadership group, get into a room and write down all the things that you need to get want in the system. So you want it to be interfaced and be able to speak the HL7 language. You need to be able to have electronic recording, electronic triage, and see for specimens. You need to be able to accept and reject samples. You need instrument interface. You need to be able to generate worksheets to be able to take to a workflow on the bench. You need to be able to bring text notes and comments rather than writing it on a paper, so the next person can follow up on your work. Because oftentimes the lab workflow is 2 to 3 days and it goes over time. We need to be able to have a phone log so you can record if someone's asked for a result, you can actually write it on the notes section. You need multi-day walk-ups for microbiology and molecular as well. You need to be able to prioritize testing. Equipment interface is important. You need to be able to generate interim reports, final reports. So these are all the things that you like and should have in your LIS or any system that you use. You need to be able to have reports as well, so you'll be able to share the report generally and widely too. I know there's a lot of requirements still that actually to report to the PHSN, but you also want to be able to report to your public health unit. You need to be able to report to the HONET with antimicrograms, etc. as well. So there are a bunch of reporting and data that you need to be able to extract from a reporting information system. So I strongly encourage, if you are looking at the implementation phase, get into a room, discuss, and write all the things you need to see. And you're already doing right now in terms of reporting that needs to come out of a laboratory information management system. So this is my second part, which is the accreditation and regional requirements of a laboratory information system. So quality management systems is something that we go through in a laboratory setting. It's always been part of our routine work that we always consider. And how do we confirm that our results are quality assured so they're accurate and reliable? So, but our model of lab testing is, we need to have the right results in the right patient at the right time. So literally, it's just the correct result on the correct patient, and which is quality assured, and we report it within the correct time frame. So it actually makes a physical difference on patient management and improve patient health outcomes. In Australia, we have the standards, and New Zealand as well, and in the Pacific region, the ISO 15189. So they're not enforced in the Pacific region, but in Australia and New Zealand, to be legally operating as a clinical or medical laboratory, you need to conform to the ISO 15189 standards, and you need to be accredited to it. So it's a set of standards, international standards, and that are monitored by a accrediting body like NATA. So that's in Australia, and IANS in New Zealand. In the Pacific region, we use WHO guidelines that are formed on ISO 15189. Now, this is implemented by the Pacific Pathology Training Center, PPTC. It's implemented by PHOA in the North Pacific. It's also implemented by SGC in the South Pacific, which overlaps between PHOA and the and it has requirements for electronic reporting and recording systems, and all of the things that laboratory needs to do, and LIS is covered in the standards and requirements. The ISO 15189 is a little bit light on the electronic requirements in terms of confidentiality, etc. So Australia has its own standards for NAPAC as well, which is requirements for information communication and reporting. And that's a really good guideline for the Pacific to use as well to ensure that your system actually meets the standard. It spells it out really, really well. And it's easy to look at and follow to ensure that the compliance is met. So, you know, I'm going to go on to the next slide, next two slides. So these are a little bit tiny, I'm sorry. But this is a actual outtake from the split up audit that like Samoa is audited against, Tonga is audited against, all these guys. So all the labs are audited against this. So any LIS system that you are looking at implementing must meet all these requirements and get the events. Shanko went earlier this year, she was here in the same hotel, going through the same exercise and checking all of these things, connecting with process control, and the other one is electronic reporting or information management systems. So mostly we'll be able to score 0 because we did heavily systems in place to be able to monitor these and answer the checklist accurately. So some of the things here is like other guidelines for patient identification, specimen collection, labeling, and transport readily available for persons responsible for primary sample collection. And some of these things will be met by the LIS system as well, right at the start when you are collecting the sample and entering it and receiving it into the laboratory information system. I'm going to go to the next one, which is a whole section 9 on information management systems. And it says, are test results legible, which is the first requirement if I go into the test result reporting. Says, are they legible, technically verified by an authorized person and confirmed against patient identity. And that can be done in a laboratory information system, and the way you mark that, I guess, or when going through the lab, you look at the final test report that is produced by the laboratory information system and score against it. The report content, so it says that the lab report content at least the following. So all of these are monitored and marked, and all of these things need to appear on the final report that is produced by the lab. So an LIS system must conform to these requirements as well to make things easier for everyone involved in terms of quality management systems and the overall accreditation feature that each of the layers can achieve. And I'll just carry that on. I think one of the things is, sorry, I wanted to highlight as well is the question that is asked in here. Where is that question? So 9.7, which says, does the lab evidence of how the LIMS or the LIMS was selected? And that's actually a question in part 2 on this scorecard. And the PPDC's checklist that's marked 25, I think. So it has a large component of scoring. So and other like that is what the verification is the other one as well. Has the system been verified for implementation? So all of those records need to be available. Within the lab services as well when you're implementing your LIS system. And then the other thing is if the information system properly maintained, you ensure continued functionality. Then goes on and breaks down the different requirements of it. So when you are implementing an LIS system in the laboratory setting, whether it be in the Pacific or in the other countries as well, very important to go through the requirements or external requirements that are required to be met by the lab system. Other examples of digital tools that we have in the Pacific, I know we spoke earlier, we had from the gastroenterologist about gastroenterology in the region. We have telepathy in the Pacific as well, so Samoa, Fiji, Tonga, Vanuatu, and some islands all have a telepathy microscope, so it does some automatic scanning of your pathology slides. And that gets packaged into a electronic slide if you like, and you could then use using either InViewer or another external software, zoom into the country setting as well, and do the interpretation from overseas, etc. And it can be used for teaching as well, it can be used for hematology, etc. too. But then the other things are like WUNET, so we know that's for AMR, so antimicrobial surveillance and sensitivity testing, reporting and collating of data. We now have the SPC Excel file that is also does AMR surveillance as well. I think that's been implemented this year. And that's another report that the lab needs to generate, and this needs to share like regionally within the region We also have the external report on PHSN and GPA as well for whole genome sequencing results that we produce in the labs, especially around COVID as well. The other things that are sort of like very cumbersome and is very paper heavy, the staff training records for training and competency, especially like the complex lab, like the GPM lab in Samoa. There's a lot of manual writing and going through each of the sections to try and kick off people with their staff training and competencies. It would be fantastic if there was for the chronic as well and management out of that setting. Then it's for quality assurance and stock management, M supplies being present in the people using it for lab services haven't been that great, unfortunately. So it's fantastic if the labs are using M supply as well and managing their stock. That way, I know we're making headway in PNG for that. But the other countries do need to come online and on board with as well. And obviously quality assurance, which I'm going to talk about briefly. So all the things that QC requires. QC is almost in line with doing a patient sample testing. We pay dollars to buy the QC materials and we test those QC materials to ensure that our results are correct. It requires informal management and it requires crossover a lot of testing of reagents, calibration, troubleshooting. We need charts to be generated out of it. And there's external software available for it. Like Bio-Rad has a QC LNG solution, Thermo Fisher have a QC solution as well. Randox have a QC solution as well. So those things are available. It would be fantastic if we can monitor that within our lab using a laboratory information system as well, or a laboratory management system. The other ones I've mentioned here is a laboratory handbook and test guide. It often changes, and we do a physical publication and then it changes the next week because something's changed, technology's been replaced. You no longer have the same supplier of the things. I'm sure, like now we're smiling knowingly. Someone just released their lab handbook last year, but it's been fantastic that it was managed through internet or something like that. Maybe a link to the laboratory information system that can feed back into the hospital information system would be fantastic. But key consideration. And then newsletter and communication between the staff where you can draw in graphs, etc. Especially when you have stock outs and things like that, or how tests are performing, you can draw it out from the information system and publish it. Stock management, I think I'm going to skip that if that's okay for a couple more minutes, maybe. Hopefully. Thank you. So with the stock management inventory system, like supply selection, ordering stock days, lead time, stress kit, access to stock where it's located and ordering mechanisms. It's very poorly done. A lot of the labs are using Excel files. You often run out of things. You use the same stock for your public health outbreak and you can use it for your clinical testing as well. So there's a lot of pressure and additional pressure from the lab itself to use, 100 test kits, not just for all the patients that are coming into the hospital, but also the same amount of test kits that you use for any public health outbreak that you might have within your community or the hospital setting. So I stock that inventory management system will help with that, absolutely help with that. And having different budget lines and managing that is the important good stock inventory management system, which M Supply will hopefully be able to cover and fix the solution for us. So just to recap quickly, a LIMS or a laboratory information management systems is software designed to improve the lab productivity and efficiency. It keeps tracks of data associated with samples and laboratory workflow instruments. It is an additional staff member of the team, automating workflows and tracking important sample information, data, workflows, QA, QC results that lab generates each day. A modern LIMS system, and now the way I've done my presentation, I see it as a modern environment that we're working in the laboratory because our requirements has changed over the years, and we're no longer fixed to a traditional way of looking at the software. We have to make it what we want it for ourselves. It is a digital backbone of lab services. It is a tool that helps you manage efficiency and costs as well. It does more than just keep track of the sample information and scientific data and results. It allows you to actively manage your entire lab process from end to end. And it reduces human error and definitely increases efficiency. So in conclusion, team, it's a complex system. The lab is a complex system with multiple digital platforms that have been used and utilized. Just remember that if you're selecting anything that you are using, it has to be user friendly. It has to be able to be integrated with the other hospital information systems that you are using or patient management systems that you are using. It has to be scalable as well, especially around dynamics, right? And you have got mass testing, etc. So, super users must be trained locally. So in the lab services, like every section that I worked in the laboratories before being a lab consultant and program manager, I will always have a few people trained as super users within the lab. So they are your first point of call. So anything that goes wrong with a digital information system. Competencies must be maintained and actually carried out. So you kind of asking people how LIS is working within the services. User acceptance testing, I think it has to be conducted by local staff. So if you are working in a lab services and some you're getting a LIS system installed, you must do user acceptance testing yourself, because this is you who's going to be using the system. Because a lot of things can go wrong. You know, it doesn't matter the number of versions you go through, do user acceptance testing and make sure it's fit for purpose. Always consider integration with other things like you see and resource management. And as part of implementation, if you have the system fantastic, but maybe set up an SOP, standard operating procedure, make sure that we have good cards available as part of the implementation. LIS is complex, there's a lot of codes that are required and used. Important to have just like a very quick code fact sheet or a cheat sheet, if you like, that can be distributed among staff. So they can use it. So you want to make it user friendly, you want the staff to use it, then make sure that they make the jump from using a paper-based system to a laboratory information management system. So think like, and this is the one slide that I wanted to take right now. I've worked around during the COVID times. We worked with the container lab systems, and this is like a picture from Niue. I feel like I've missed an opportunity as I worked in about 80 different projects on the classification for PPTC. Because we were doing all the funding, writing of the budget, but I felt like I missed a very unique opportunity where you could put a laboratory information systems in these units, that could be easily integrated. So I wish I had spoken to BPS about this. This was in 2020, 2021. Then it would be a fantastic opportunity. Right? So I think the reason I bring this here is like, if you're thinking of a new project or whatever, think of everything, right? If you can. Because it's hard in these things when you try and think outside the box as well, and what would be most useful for the end user, and look at opportunities which can be brought in to improve your services, and improve patient health outcomes in the country. So, Punaka level, thank you very much for listening to me. Thank you, BES and M Supply, for hosting this event, which has been fantastic. Great to meet our colleagues and make new acquaintances. And I appreciate it. So please feel free to reach out my emails there as well. If you have any questions, you ask.
A couple of minutes for questions if anyone has anything burning.
Okay. Yeah, thanks. That was an awesome presentation. And I'm not a lab person. I actually don't even have access to the lab in my institute. But I was wondering, in terms of uptake of new kind of LIS systems, what have you kind of experienced, I guess, or what are the major bottlenecks and barriers that you found to uptake and getting things in place?
I think the main thing is the availability of a suitable, what do you call it, suitable solution for the testing. And sometimes fairly new to BES as a solution. But the key thing, like Fiji, for example, is paying the licensing fee. Yeah, 140K maybe a year or something like that for all the services. But by Timor-Leste is an example as well, where bigger barrier was there was not enough consultation done locally before the system was put into them. This was when St. John Port was working in Timor-Leste. And users used to sabotage the server rooms and stuff. Because they just didn't want to use the system, there was not enough consultation, etc. But the key thing is having a budget, having systems in place, like the workstations around IT infrastructure, not existing. So those are the key barriers. So you need those in place, And I think this is why like labs have been using automation and electronic systems for a long time, but they've never had an LIS, mainly because there's no infrastructure around it to support that. So now at the back of which has been implemented, the lab information systems can now come in place to suit the services.
Thank you.
Hello, thank you for the presentation. I was just curious, the ongoing work that you're doing in the Pacific, are you working with specific countries to kind of build the capacity, as you say, or what? How is that working?
Yeah, thank you. So, so in my current role at the moment, we are very much working in a very remote setting. So the lab that I work in is a reference laboratory. So, say for example, if someone has a flu outbreak, they will send samples over to us, and we'll be able to do reference testing for. We might be able to provide some advice to them for setting up their own testing assays, etc. But there are regional organizations that do provide technical training and support to the Pacific region, and one of them is PPTC, the other is SPC, and the third one is PHOA. So they do work very closely with all the Pacific lab partners in terms of strengthening technically. Lab information systems always been a hamstring because again the support systems hasn't been around to support it. But there are opportunities I think in this space to work together with implementers to provide that support. Oh, good. So thank you guys. Thank you very much.
Give me 2 seconds.